News Channel 5 Network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. And Nick Barris here on a Tuesday. Well, did I not put my mic on? I'm sorry. You know, I just came over from the anchor desk and was running around. Now I've got my mic. It's not the first time I've done that. But Nick Barris here. Thanks for joining us on MorningLine on this Tuesday. And we've got a good show on tap for you. This is a live program. You know, we're going to open up the phone lines. I want to say that we're not only coming to you on the Plus right now, but we're also going to be streaming live on Facebook at newschannel5.com. And I'm going to make sure that I've got us up on there. And if any of you have questions or comments for our guest this morning, jump in there and we'll take those as we get some updates on the latest that's happening behind bars, if you will. And when we're talking about the situation in jails and prisons and with the COVID-19 and the pandemic, that's one of the things we can talk this morning with Davidson County Sheriff Daron Hall, who is joining me now in studio for the first time in several weeks. And you're social separating more than 10 feet from me, but last time someone came in there, and it's been a regular thing, has been Jim Schulman, the vice mayor.
Yeah.
It's good to have you in this morning. Why did you decide you wanted to come in person?
You know, I'm up anyway and was moving around our office, something that was by all means very minor in the scheme of things, but the tornado actually tore our office out, our headquarters building right over here, and so we've moved to the north campus, which is up on the old Memorial Hospital up off due west. So I drive through here anyway, and I told Mary Lane, I said, well, you know, whatever's easiest, but I need to get out of the house a little bit.
I hear you.
And so we go to the office and get most of our work done, and this feels a little more normal, but whatever's the best for everyone, we're trying to do that.
Yeah, listen, I appreciate you coming in, and it is safe the way we have this set up. It's fine, but we don't have a lot coming into the station, but we figure the sheriff? Yeah. Anyway, it's good to have you on. We have a lot of people following us who may have questions or comments right now, watching us on Facebook at newschannel5.com, and if you want to call in and join in the conversation. But why don't we start right at the top here? You know, we've been monitoring fairly closely at a lot of the prisons and jails across the region, and especially in the Middle Tennessee area. And most recently, I guess we were just going over some of the numbers. You had what I think you've termed a cluster at one portion of the jail facility and how you're handling that. So fill us in on that. How many positives now in the Davidson County Jail, and what's the response been?
Yeah, Nick, one thing that would help everybody kind of understand is when we say jail or jails, they're all built differently, and usually that's driven by the classification of the arrestee or their inmate. So what that means is the higher risk inmates are in individual cells, lockdown type of environments, the very high level security folks. They would be located right across the street here in our new facility. But the lower level, the minimum security folks who are sometimes doing misdemeanor sentences or awaiting trial on misdemeanor charges, they're all housed in a lesser secure facility, which is typically a dormitory, a big open room. If you can imagine going to summer camp, if you will, where there's a bunch of bunks in one room. That's really what this is on the Harding campus. And so the good news is it's a low security facility. Good news is it's sometimes a better environment for a lot of folks to be in. Bad news is when you have an airborne disease like this, very, very difficult to control because you're all sharing a lot of airspace, unlike, say, the ones that are in individual rooms. So we have been aware and very nervous that once we get a cluster or several cases inside of a unit like this, it's going to be very hard to manage because, quite frankly, they're all sharing a lot of common space. So that's what happened. Gosh, I think a week or so ago, we had a positive or a person who was symptomatic. That person turned out to be a positive case. Eventually, we took that individual out and isolated him, and that number turned into 48 additional people. We then isolated all 48 people away from one another. And so once we had that many positives, the health department decided to test everyone at the facility, which totaled 505 people. And out of that latest number of 505 tests, there were 182 positives total. And, you know, that's a large number of people inside of an environment. The problem for us is we were trying to isolate, you know, Nick Barris and Daron Hall and everyone that was positive from other inmates so it wouldn't spread. Now that you've got this large number of positives, what we're doing is cohorting those folks. And so the health directive is that if you and I are both positive, there's no risk that you and I are sharing the disease. We both have it. So we've moved the positives together and leaving everyone else with the potential of being separated, and that's at the directive of the health department.
Social separation is a good thing, and I already see several comments coming in on Facebook asking the question. We know that there's a mandate now in Metro from the mayor about wearing masks and social separating. So are masks an option for your inmates? I mean, why not when they come in? And I assume when they first are brought into the jail, you test them for COVID. So, okay, if they're negative, then, you move them in there. Now, should they not all be given masks maybe as well? I mean, is that something being done or something considered?
Yeah, so we started this a long time ago, 3 months ago maybe. When you arrive at the jail, you're given what we call a disposable mask, a mask that you're right away.
Sure.
And that's given to you in booking. If you stay overnight, which basically means if you don't bond out, then you're given 2 additional masks, and those masks are reusable. They're not the disposable kind necessarily. So, yeah, every inmate has a mask. They have it the entire time. Just like in the public, just like you and I, we haven't been forced to wear one until today. Enforcing wearing masks in the jail is going to be very difficult to do, just because these are multiple multiple beds inside of one big dormitory. Well, we can't make you sleep in it. We can't make you shower in it. And so it's impossible to say make every inmate wear a mask. It is not impossible to give them all one and require them to wear it if they ever leave their housing unit, leave where they live, and that's how we're doing it now. But again, look, there's people talking about restaurants and bars and clusters in the public and beaches, and I heard a birthday party and all this. It's virtually impossible once you have this type of contagious airborne disease to be controlled in a dormitory environment like that for a long period of time. We've been expecting some sort of outbreak.
Sure.
It's just impossible when you're having people being arrested and brought in and released, arrested and brought in and released. And keep in mind, what's depressing to me is we can test everybody. We just tested 505 people last Wednesday. Those tests are no longer valid.
Right.
I mean, we test them every
you're
day.
tested, you come back negative, and then it's a matter of, all right, you're that moment you are.
Right.
But seconds later you could be exposed, and then you have to be tested again. You know what's curious to me too, was I accurate when I said that when you do have an inmate that's brought in to the facility, they're tested initially after they've been arrested, correct?
Well, their temperature's taken.
Okay.
They're not COVID tested because, quite frankly, they'll be released and moving on before you would ever get them back in. The health department has basically said if you're symptomatic, immediately you're taken away and tested. If you have a temperature, you're tested, but if not, you're not tested until you're symptomatic, as we've done everyone else.
Okay, what's interesting, and we're not doctors here and you're not, but just your personal observation, because there is some question about whether or not someone who's asymptomatic is contagious. And we still maybe don't have a clear answer on that. There have been different studies, but you at least know, based on what you see, when they come in, they're not showing any symptoms, no one has any symptoms, then all of a sudden it comes out. Is your observation that it appears as though it is spreading among them even if they're asymptomatic?
Yeah, Nick, as a person, I've been hoping that the asymptomatic cases couldn't spread. And again, I'm not a doctor, but the reality of it is every one of these inmates, except that first one I identified, were not symptomatic when they were tested. And therefore, the 182 positives, you can assume 181 of those was spread amongst folks who were at least asymptomatic, because they're not seeing the medical staff, they're not asking or sick. And so somehow or another it spreads pretty quickly with people who are asymptomatic inside the facilities, and we believe that's going to continue. This isn't an environment where you have a bunch of people laying around in their bunks sick and having a temperature and feverish and feeling bad. These are people running around the hallway or in their housing unit, and then all of a sudden when we force test them, then it turns up to be 181 people that are actually positive. So. I've been told this all my life. I think it's fair to think of it, but a jail is a microcosm of the community, meaning you have large environments, small environments, you have young and old, you have all sorts of things, and so just like you hear, and whether it's the restaurants or whether it's the protest, or there's a lot of large gatherings, it's just impossible to believe that all of that's not having some impact on spreading the disease. I don't care if it's an event you support or not. Just like in a jail setting, when you have a large group of people participating in any activity such as sleeping or living, it's going to eventually catch and spread. There's just hardly a way to avoid that.
Yeah, as we see it both behind bars and out in the free world. Listen, we'll take a quick break here, Sheriff. When we come back, we've got some comments on Facebook and we have some calls. Joe wants to talk to you as well, as always.
Right.
So we'll take a break and we'll come back. We are streaming live on Facebook at newschannel5.com. Questions or comments for Daron Hall, message me here, or if you'd like to call in, you see the number on the screen. We'll get those as we'll continue to talk with him until the top of the hour. We'll be back with more right after this.